NPTE StudyCast.
All right, here we are at NPTE StudyCast. Bridget Ripa is back. Bridget, we're talking about TIA. What does it actually stand for? Can you pronounce it? Because I always screw it up.
Oh, gosh. I know. It's early in the morning, too. Transient Ischemic attack.
You did well. See, you got it. I always trip over ischemic.
It's hard with the C in there.
So what is it? Describe it briefly.
Basically, it's the same underlying mechanism as an ischemic stroke. It's just the duration of symptoms is so much less. So it's a brief episode of neurological dysfunction caused by ischemia to the brain. Instead of having tissue death, like with stroke, there's no tissue death.
Anatomy.
So what's involved? We know the brain in terms of anatomy, and what else? What caused it?
Just like a stroke, it depends on where in the brain it happens. The big difference is the duration of symptoms. So usually there's a complete resolution of symptoms within 24 hours. But there also are these things called crescendo TIAs, which is where you have at least 2 within 24 hours, 3 within 3 days, or 4 within 2 weeks. So that's kind of the definition of crescendo TIAs.
What is this going to look like? How are we going to present? I know it's the brain, so depending on where, things can be different, but is there an overarching theme?
Yeah, it looks exactly like a stroke almost until you do some imaging. So clinically, it's going to look like a stroke. It could potentially present like a seizure disorder, tumor, sometimes migraines, hypoglycemia, MS, vertigo. But typically, you're going to see this person and think that they're having a stroke.
Special tests.
Now, how do you prove it or disprove it? What are the special tests?
You're going to do imaging just like with a stroke, so CT, MRI, but you're going to also heavily rely on your clinical exam. So there's something called the ABCD2 prediction rule, which is a prediction rule for stroke risk after TIA. So that's something that you'll see a lot with TIA is what is the risk of somebody's stroke after they've had a TIA? The A stands for age. So is your age greater or equal to 60 years? Your BP. So is your systolic BP greater than 140 or diastolic greater than 90? So the C stands for clinical presentation. So do you have unilateral weakness with or without speech impairment? And then the first D, because there's 2 Ds, is duration. So duration of symptoms. And then the second D is whether or not you have diabetes. And then if you look up that rule, you get assigned certain points. And if you're at a certain point number, you have a higher risk of a stroke after a TIA.
It's also good for the NPTE because they typically will present questions as patient cases. So knowing those, the A, B, C, D, D, age, BP, clinical presentation, duration of symptoms, or diabetes,
Yes.
will kind of help you guide you towards if it's a TIA or not.
Definitely.
Treatment examples.
Now, what does the PT do about it? Treatment examples, I'm guessing more along the lines of stroke rehabilitation.
Yeah, treat the person as they present with their impairments. But a lot of times the resolution of symptoms happens so quickly, we're not even really treating these patients unless you're seeing them maybe more frequently and like on an outpatient basis. So typically you're not going to really do a whole lot for their symptoms, but you are going to educate them about their risk factors, especially about the crescendo TIAs. And then again, just treat their deficits as you would as they present to you.
Gotcha.
Here's your example question.
And then how will it be tested on the NPTE? Any glimpses into that?
Yeah, I would definitely say that ABCD2 or ABCDD prediction rule is really important. And then just the differentiation between stroke and TIA. So if they give you a patient case, can you differentiate between it being a stroke versus a TIA?
Transient ischemic attack. See, I did it.
You did a good job.
That's all you need to know.
NPTE
Perfect.
StudyCast. Brewed by the PT Pintcast.